number 424 is now arriving.
Hi, this is Yoon Ji-jung and I live in Seoul. People around the world are facing great threats from COVID-19. But thanks to Korea's response to COVID-19 known as K-quarantine, it's just another normal day for me. I experienced how well organized the K-quarantine and Korean medical system based on ICT are while I was fighting against COVID-19. That said, I would like to share how I overcame COVID-19. One day, I started the day off by stopping at a cafe on the way to work. The COVID-19 epidemiological investigation support system can quickly identify transmission routes and inform the public of infection information through SMS notifications. Oh my! That's where I work! There has been a confirmed case in a company cafeteria. You might have been in contact with him or her when you visited the cafeteria, so please take self-quarantine measures immediately and get tested if you have any symptoms. Thus, I was able to find out that I came in contact with a confirmed patient thanks to the COVID-19 epidemiological investigation support system. In Korea, a person who had contact with infected patients should be under self-quarantine for 2 weeks. The person under self-quarantine should install the self-quarantine safety protection app on a mobile phone and should be managed by a public officer in charge. In Korea, artificial intelligence helps manage the heavy workload at the public health center. It is called AI COVID-19 Care Call.
I'm calling to check if you have any symptoms related to COVID-19. Do you have a fever now?
No.
Okay, I see. So, do you have symptoms of coughing or shortness of breath?
No. AI COVID-19 Care Call made these calls twice a day to check my health condition. It was reassuring to see that my health condition was being automatically reported to the public health center. All of a sudden, I have a fever and a cough.
Okay, I see. Please visit your nearest screening clinic for a diagnostic test.
Drive-through screening in Korea gained much worldwide attention as an innovative way for COVID-19 testing. I tried the drive-through screening, and it was really convenient and safe for everyone. With an AI-based diagnostic reagent developed by a Korean pharmaceutical company, my test result was provided within 6 hours. Unfortunately, I was tested positive for COVID-19. After being confirmed, I was admitted to a residential treatment center for intensive care. There, the medical staff played vital roles in saving lives and fighting against COVID-19. Fortunately, less mistakes are made in reading X-rays with the help of AI, and this prevents misdiagnosis, which is a tremendous help to medical staffs. I received my COVID-19 test result through remote consultation with a doctor who is in charge. And thanks to the ITS, medical institutions could check my overseas travel history right away and identify the exact route of infection. Suddenly, my symptoms got worse since I had an underlying disease. I was classified as a severe patient, and I was in an emergency situation where I should be urgently transferred to a hospital. Fortunately, for severe cases who need intensive care like me, the operational status data of negative pressure rooms at each medical institution was systematically managed in real time through the negative pressure isolation room information system. Thanks to the system, I was transferred to the designated hospital equipped with a negative pressure isolation room within the golden hour. Amid the emergency, the newly assigned doctor checked my underlying health condition and immediately connected to the DUR system to avoid any potential adverse drug reactions. The Drug Utilization Review Service, called the DUR, is designed to prevent inappropriate use of drugs by providing necessary information on drug safety in advance to doctors or pharmacists when prescribing or preparing medicine. And with the help of a fully equipped medical system, I was able to recover from COVID-19. It was all thanks to K-quarantine with ICT applied throughout the process. The COVID-19 pandemic is still sweeping the world, and we're even facing greater threats. However, the more the dark clouds of COVID-19 gather, the brighter Korea's ICT will shine. ICT Korea Beyond COVID-19. K-quarantine is creating a new ICT road.